Hi, my name is Saj Rambab. I'm one of the respiratory therapists at Morlen Health.
And I'm Ed Birnbaum, another respiratory therapist at Morlen Health Pulmonary Rehabilitation Program.
Today's topic for Breathe Better 101 is sleep apnea, and it's part of our pulmonary rehab educational series. So first, for this topic, we'll go over some definitions. We have a lot of abbreviations and some definitions. So let's just get those out of the way. So OSA stands for obstructive sleep apnea. CSA stands for central sleep apnea. CPAP stands for continuous positive airway pressure. BiPAP stands for bi-level positive airway pressure. And CPAP and BiPAP are sometimes used interchangeably when people talk about sleep machines that they wear at night when they go to bed. PAP is positive airway pressure. NIV is also called non-invasive ventilation. Sometimes people will use BiPAP and non-invasive ventilation synonymously, and they're not technically the same. And then there's NIPPV, which is non-invasive positive pressure ventilation. Again, muddying up the waters a little bit. And then polysomnography, which is just a sleep study. So there's all these little definitions that are associated with these abbreviations, and you'll hear them throughout the topic, the presentation, but we'll explain it in more detail as we go along.
Right.
So the American Sleep Association statistics. So 50 to 70 million adults in the US are affected by a sleep disorder. 25 million adults in the US have obstructive sleep apnea. And between 9 and 21% of women have obstructive sleep apnea, whereas between 24 and 31% of men have obstructive sleep apnea. And that's from the American Sleep Association from 2021.
That's a lot of people.
It's much more common than we think. And so the three main types of sleep apnea, and we're really going to focus in mostly on obstructive sleep apnea. So you have obstructive sleep apnea, or OSA, which is the most common type of sleep apnea, and it's caused by a blockage of the airway during sleep. In obstructive sleep apnea, the throat muscles relax and a person's tongue and soft palate collapse against the back of the throat during sleep, closing the airway, which causes the snoring. That's the obstruction. And then central sleep apnea, or CSA, is a rarer form of sleep apnea that is caused by the brain failing to send the right signal to the muscles to control breathing during sleep. There is no airway blockage in CSA. Now, you can have mixed sleep apnea, which is also called complex sleep apnea syndrome. And as the name implies, it combines both OSA, obstructive sleep apnea, and CSA, central sleep apnea. So that's where you get all of them in one big definition.
Right. And then we're going to talk about why this matters so much and what we do about it.
So some of the symptoms of sleep apnea. Number one is that your partner will tell you that you snore, you stop breathing at night, and you periodically make concerning gasping or choking noises at night. Now, what you feel, if you're the person that's having those symptoms, is you'll feel not well rested. You feel groggy and foggy during the day, need a mid-morning or mid-afternoon nap. You have a lack of energy and a morning headache.
Right.
And so causes of sleep apnea for the obstructive, like I said, it's relaxation of the muscles at the back of the airway and the breathing effort with narrowed and closed airways. So that's what causes that snoring. And central, like we mentioned, the brain doesn't transmit the correct signals. And we're going to discuss in more detail more of the obstructive and what we do for the obstructive or the floppy airway.
Mm-hmm.
So risk factors for obstructive are increased weight, increased neck circumference. So one way that we get for men to diagnose their neck circumference is sometimes their collar size, so their shirt size for their collared shirts. Enlarged throat structures can lead to narrowing of airways. So if you have tonsils and adenoids still, those will be swollen and inflamed, and those can lead to narrowing of the airways. Alcohol and sedatives at nights. It's more common with smokers. There's also connection with nasal congestion and deviated symptoms. Now, with stroke, the risk factors, with central, some of the risk factors are stroke, older in age, and it's more common in males. And you can also have other types of head injuries or brain injuries.
But overwhelmingly, there's a lot more obstructive sleep apnea than central sleep apnea. Both occur, but most when people talk about sleep apnea, they're usually talking about obstructive sleep apnea.
So, what does apnea make worse? A lot of people will think, oh, I'm sleeping just fine. I'm getting about 8 hours of sleep, but it's not that high quality sleep. So, lack of good quality sleep is a stressor, and stressors can have a wide ranging impacts on health, including increased blood pressure. So, if you have hypertension, high blood pressure, it can make it worse. Increased risk of strokes, increased risks of diabetes, and difficulty to control the diabetes. Tiredness during the day, so you can be short tempered, and then sleepy driving. There's been studies where sleeping driving is just as bad as intoxicated, so DWI or DUI. Weight gain, because you can be stress eating. When you're stressed, sometimes people eat. If you're not getting good sleep at night, if you wake up, what's the first thing that most people do is they'll probably just go watch TV, maybe grab a snack. And then cranky partners. So you keep your partners awake, they get less sleep, and they in turn get cranky, and then it makes you more cranky. So always have to think of all the people that are involved in the situation, and it's not just you and your signs and symptoms, but it's also your partners or your family's signs and symptoms.
So for all these reasons, sometimes correcting sleep apnea can be one of the best things you can do for your health.
So, importance of quality sleep. So, most adults need 7 or more hours of good quality sleep, so high quality sleep. Sleep is required to allow your body and mind to recharge, recover, and repair. Consistent lack of good quality sleep can lead to mood disorders, anxiety and depression, weight gain, increased risk of diabetes, stress. Good quality sleep makes your mind and body work better.
That's right.
So the diagnosis and treatment. So the diagnosis is pretty straightforward. So you speak with your healthcare provider about your snoring and sleep concerns, and generally they'll order a polysomnography, which is a sleep study, or a home sleep test. And those are usually two main ways that you use to diagnose sleep apnea. Now, the sleep study, you would have to go into a sleep center, and they sometimes do a split night study or a 2 night study back in the old days. Or a lot of companies now or providers will send you with a home sleep study test where you'll strap this thing to your wrist and a pulse oximeter and these little nasal cannula in your nose and sort of see how you're breathing at night or how you're not breathing at night. And then you can send that device back to the company. They'll download the data and send it to your sleep doctor or your primary care doctor. Now, treatment options, there are a few. So the most common one is wearing that CPAP or BiPAP at night. Now you have your CPAP, which is your continuous positive airway pressure. You have your auto CPAP, which is it'll adjust between a certain range that your provider sets. BiPAP is you have two different pressures. So think of it like your blood pressure. You have your systolic and your diastolic. You'll have your IPAP and your EPAP. So your upper number and your lower number. And it actually makes it easier for you to exhale. And then there's oral appliances. You'll see a lot of those on TV as well, like these like boxers mouth guards, but it'll actually move your lower jaw a little bit forward. So you'll have to go to the dentist sometimes for that. Sometimes people add oxygen to it. Sometimes you can have surgery. You have your tonsils and adenoids taken out. And now there's this pretty new one out, and I forgot the name, but it can do nerve stimulation. So it's this implantable device like a pacemaker or a defibrillator. It'll actually stimulate the nerves in your throat. That'll help keep your airway open. And then also weight loss. So sometimes when people lose a significant amount of weight, it makes their sleep apnea get better, and sometimes can eliminate it. Not all the time, but sometimes.
That's right.
So how is the pressure generated? So the pressure is generated and maintained by flow. So the higher the pressure, the greater the flow. So commonly when we have patients who come to the hospital and we put them on a CPAP, we usually say we'll start them off with like a CPAP of 7 to 10. And that actually has a fairly calm an easy flow pressure. But as you go up, that flow gets more. So it's not very comfortable as it gets as the sleep apnea CPAP pressure gets higher. So that's something to keep in mind because in our nose we have flow receptors. The nose hairs are flow receptors, the cilia are flow receptors. And so if we put our heads in front of a fan as we were kids, you feel like you can't breathe, but we know you can breathe. No one's holding us down, no one's covering our face. It's just that flow that's going into our nose and onto our face that makes it feel like we can't breathe. You might get that same sensation that you can't breathe when the first time you wear a CPAP because there's that flow blowing into our faces and into our nose. Dogs put their heads out the window, their ears are flapping in the wind, they love it. Humans, not so much. So it takes a little bit of time to get used to it, and it's good to understand the concept of the pressure is determined or brought about by flow.
Right.
And so why do you need the pressure? The pressure stents the upper airway open and preventing it from collapsing. So when we talk about obstructive sleep apnea, it's a floppy airway. The airway collapses. So what we need is a column of air, of blowing air, this flow of air into your upper airway to keep that airway from collapsing, to keep it open. And the correct pressure will stop the snore. And all it does is it allows your breathing to get back to normal. So what the CPAP pressure is doing is it just keeping your airway open, it's stenting it open like a scaffolding, like an air scaffolding, and then it's allowing your body to just breathe normally. So really, we're trying to get you back to baseline.
Right. It's what we're trying to find is just the right amount of pressure that keeps the airway open, not less and not more. And sometimes that's a matter of trial and error to get that. Well, when it's accomplished, then things are much better.
So CPAP machines. So really, they provide continuous positive airway pressure. So when they set you with a CPAP of, let's just say 7, you're always going to be breathing with the pressure of 7 and then breathing out with the pressure. So when you breathe in, you're breathing with that pressure. And when you exhale, you're breathing out against that same pressure. So sometimes that can be a little bit difficult for people, especially if their CPAP pressure is on the higher side. So the pressure delivered is constant, right? It's continuous. It's better tolerated the lower pressures. Generally, the machines are less expensive because they're just doing one thing. They're just doing continuous positive airway pressure at one setting.
And these are the most common machines that people use at home.
And the BiPAP machines are the bi-level pressure. Think of it like the blood pressure, like I stated, and you inhale, so you breathe in with the higher pressure. So let's say your BiPAP pressure is 10/5. When you breathe in, you're getting that pressure of 10 or that flow of 10, as it may. And when you exhale, when you breathe out, you're breathing out, the machine drops to the pressure of 5, and you're breathing out against a lower flow or lower pressure. So it's easier for you to exhale. So sometimes it'll make people feel less claustrophobic and easier to exhale, of course, because you're dropping the pressure. But also if you wear BiPAPs at higher pressure or CPAPs at higher pressure, they'll switch you to a BiPAP. So sometimes we'll go up to 20/10 or 15/10 or something like that. But at those higher pressures, the BiPAPs are generally better tolerated. They are a little bit more expensive, of course, because you're doing 2 different pressures. More likely to use a full face mask, just because if you're using it at higher pressure, you want that flow and that pressure to go into your upper airway by any means necessary. So the air will go in through your nose and it'll go into your mouth. It's much more difficult to get that much pressure into just your nose. And then with those machines, some of the higher end machines, you can add a respiratory rate. So if you stop breathing a little bit, you can add a backup rate. So the machine will actually breathe for you as well.
Right. So that higher pressure is actually helping push the air in as you're inhaling. And the lower pressure is just enough to keep the airway open all the time. And it's actually it can be used as a breathing machine. When Saj talks about a respiratory rate, if somebody was not initiating any breaths of their own, they weren't breathing on their own, that machine will breathe for them, you might say. Now, that's not why we're using it in this case. Some people are just more comfortable getting that higher pressure as they inhale, and and then down to the lower pressure. But for some people with just sleep apnea who don't have obstructive, who do have obstructive sleep apnea but can breathe on their own, they're more comfortable and it works better for their sleep apnea as well.
So the mask types, you generally have three types that are the most common. So you have your nasal pillows, which are like prongs. If you've ever worn a nasal cannula, it's just like a big beefy version of that. These little pillows go into your nostrils a little bit, and they get the pressure in that way. The nasal mask, so this actual mask covers the nose, and it sits above the upper lip. The difference between those two is really the nasal pillows is a little bit smaller form factor, and you can wear glasses. So if you wear glasses to read and watch TV, it's easier than that. And the nasal mask, it's going to be very, very difficult for you to wear glasses when with those to put those on. It's going to be distracting to read because you're going to have that centerpiece that goes over the bridge of your nose to your forehead. And then, of course, the full face mask. So that covers your nose and your mouth. And that's going to be the biggest one for most people that are going to use. And again, it's impossible to wear glasses. Not impossible, but it's very difficult to wear glasses with that. So if you need it to glasses to read or to watch TV, it might be a problem. Also, mask style, so the nasal mask and the full face mask can sometimes trigger people's claustrophobia. So that's something to also be aware of.
Right. So what you might want to take home with you from this talk about all this is that there are different strokes for different folks, and we don't know when we see you for even an hour, if we get that much time with you one time. We don't know what's going to work for you at home. It might might have seemed good when we saw you, but then when you tried it out over a period of time, it didn't. There are alternatives. You should know that all of these can work for different people, and you give one thing a try, come back. If it's not working for you, let your provider know, and you might be able to be fitted with something that works better for you.
And then what about oxygen? So during your sleep study, whether it's the home or the lab-based, sleep center-based, they'll hook up a pulse ox probe, so a little finger probe on you, and they'll be able to tell if your oxygen dips. If your oxygen dips and it's concerning for your provider, they will add oxygen into your CPAP or BiPAP at night. And so you'll have a concentrator in the house that'll look similar to this. There's a lot of different styles out there, different colors, makes, and models. And then you'll have this little adapter, as they call this, the bleed-in adapter. So really what you'll do is you'll hook up an oxygen tube from the concentrator right to there, and then you'll turn this on, and this is this on switch here, on and off switch here, and then you're going to dial the flow meter, and there's going to be a little ball in that glass cylinder there that's going to give you the flow. Now that will be prescribed by your physician as well. So not only do your CPAP and BiPAP pressures prescribed, also your oxygen level that's going to be bled into your CPAP at night is also going to be prescribed. So whatever they prescribe you to do, you should keep it at that setting. So most of the times when I did home care setups, we'd set this to the actual setting that they needed, and we would make sure that we would just leave that on and leave that there, and then turn it off. So when they turned it back on, they would just have to double check to make sure that little ball was in the level that was supposed to be. Usually 1 or 2 liters per minute was being bled into the CPAP by this bleed-in adapter here that's attached to the machine.
And all this needs to be prescribed.
So the key points to take away is sleep apnea is a lot more common than you think. It can be treated relatively easily. Ask friends and family about their experience with sleep apnea. And remember, drowsy driving is dangerous. I think for our bus system here locally, and I think for long haul truckers in the Pacific Northwest, if they had a history of sleep apnea, they had to be treated with it. They had to have CPAP machines, and they had to actually wear it for a certain amount of time to pass their DOT license. And then write down questions, concerns about sleep issues to ask your provider. It's very, very difficult for some people to understand what sleep apnea is and why we're treating it and the device, and it's just cumbersome and you just want to get to bed and just lay your head down and go to sleep. So make sure you ask the questions. So write them down so you don't forget them.
I want to say one thing. Well, no, go ahead, Saj, and I'll hold off on my comment.
So questions. So does CPAP and BiPAP cure sleep apnea? So no, it eliminates it while you're using the machines, but it doesn't cure sleep apnea. So if you don't use your sleep apnea machine and nothing's changed, like you haven't lost a significant amount of weight, you haven't had a surgery, then your sleep apnea will come back. Now, is it hard to get used to the machines? It is hard. So to help get used to wearing the mask when you're sleeping, practice using it during the day. So sit in the chair while you're watching TV or reading or meditating. Just wear it during the day. It's not going to hurt. It's just going to desensitize you to using the CPAP and the mask. And then when you wear it at night, it won't be so unfamiliar. It won't be so much of a shock to you. You'll be more inclined to wear it at night, and it'll be easier for you to wear it tonight if you wear it during the day as well, just while you're just doing stuff. And is a CPAP or BiPAP machine bad for you? No, there's not a serious health risk derived from using the CPAP machines to treat sleep apnea. There are some, issues that you can have with it. That's why we have all these safety devices in there. We have these little exhalation valves in there. So if the power goes out, you're not going to suffocate. You'll be able to exhale through the machine. So, you can't get addicted to the machine, and it's not bad for you. And will I ever be able to stop using my CPAP machine? Some patients may be able to stop using it if they've lost weight or no longer have sleep apnea. For example, some patients who have surgery or who do well with positional therapy or oral appliances may no longer need to use CPAP machines. So it all depends. And again, ask your provider to see what they think and what they can do.
And what I'd like to add is that Saj and I both worked with a lot of really serious chronic lung disease, and sometimes we don't always see good outcomes. I have seen, and I'm pretty sure Saj has as well, some cases where people have had sleep apnea and responded very well to treatment, and it has made an enormous difference in their lives. All the issues that Saj listed that can be consequences of sleep apnea. When the sleep apnea improves, those things have improved. I've seen people lose weight, get more active, be able to exercise more, even improve their marriages. So it can be it's really worth looking into if it could be something that you have to deal with. Dealing with it successfully can be enormously beneficial. So stick with it.
And that's it. Thanks again for taking the time to watch our presentation. If you have questions or you need more information, please go to morlenhealth.com.
I hope it's been helpful for you.